A global failure, the war on drugs. This term has become synonymous with a misguided and ultimately futile effort to control the production, distribution and consumption of illegal substances. Despite the immense resources poured into this campaign, the results have been disheartening. Written by Johann Hari, Chasing the Scream: The First and Last Days of the War on Drugs. This book delves deep into the origins and consequences of this prolonged conflict, offering a comprehensive analysis of its failures and the human cost involved. The war on drugs has raged for over half a century. It began with the intention of creating a drug-free world, but over the decades, it has morphed into a relentless and often brutal campaign that has touched every corner of the globe. From the streets of Los Angeles to the jungles of Colombia, billions of dollars have been spent, and countless lives have been lost. The impact has been felt in urban centers and remote areas alike, with communities torn apart by violence and fear. Yet, the illegal drug trade thrives. Despite the best efforts of law enforcement agencies, the demand for drugs remains high, and the supply chain continues to adapt and evolve, becoming more sophisticated and elusive. This so-called war has been a catastrophic failure, leaving devastation in its wake. Families have been torn apart, neighborhoods have been ravaged, and the social fabric of many communities has been irreparably damaged. It's time to acknowledge this failure and explore alternative approaches to drug use and addiction. We need to shift our focus from punishment to prevention, from criminalization to compassion, and from enforcement to education. The stated goal of the war on drugs was to eradicate illegal drugs and punish those who use and sell them. However, this approach has not only failed to achieve its objectives but has also exacerbated the very problems it sought to solve. However, this approach has proven ineffective and counterproductive. Instead of curbing drug use, it has driven it underground, making it more dangerous and harder to control. Instead of reducing drug use, it has fueled violence, corruption, and mass incarceration. Prisons are overflowing with non-violent drug offenders, and law enforcement agencies are often stretched thin, dealing with the fallout of this failed policy. It's time for a new approach, one that prioritizes public health, human rights, and evidence-based solutions. By treating drug addiction as a health issue rather than a criminal one, we can begin to heal the wounds inflicted by this long and costly war. Nixon's legacy: the birth of a flawed war. The modern war on drugs can be traced back to the Nixon administration in the early 1970s. It was a time of great social upheaval and political tension in the United States. The country was grappling with the aftermath of the Civil Rights Movement, the Vietnam War, and a growing counterculture that challenged traditional norms. In this climate, President Nixon declared drug abuse public enemy number one and launched a campaign of criminalization and law enforcement. This declaration was not just a policy stance but a strategic move to gain political leverage. By framing drug abuse as a criminal issue rather than a public health crisis, Nixon aimed to rally support from conservative voters and distract from other pressing issues. This approach, heavily influenced by political motivations rather than public health concerns, marked the beginning of a costly and ineffective war. The focus was on punitive measures with little regard for the underlying social and economic factors that contributed to drug abuse. This strategy ignored the complexities of addiction and the need for comprehensive treatment and prevention programs. One of the first casualties of this new war was the shift in focus from treatment to punishment. Drug treatment centers, which had been providing essential services to those struggling with addiction, saw their funding slashed. Many facilities were forced to shut down, leaving countless individuals without access to the help they desperately needed. Meanwhile, law enforcement agencies saw a significant increase in their budgets. Funding for drug treatment programs was slashed, while law enforcement agencies saw a significant increase in their budgets. This shift in resources reflected the administration's priorities: punishment over rehabilitation, criminalization over compassion. This punitive approach, prioritizing punishment over rehabilitation, laid the foundation for the mass incarceration crisis that continues to plague the United States today. The prison population skyrocketed as non-violent drug offenders were given lengthy sentences. This not only devastated communities but also placed a tremendous financial burden on the state. The Nixon administration's legacy is a stark reminder of how political expediency can trump evidence-based policy, leading to disastrous consequences. The war on drugs, born out of political maneuvering, has had lasting impacts on American society, from overcrowded prisons to fractured communities. It serves as a cautionary tale of what happens when policy is driven by politics rather than compassion and common sense. Prohibition's pitfalls, lessons unlearned. The futility of prohibition is not a new lesson. The US learned it the hard way with the prohibition of alcohol in the 1920s. This period gave rise to powerful criminal organizations, increased violence, and ultimately failed to curb alcohol consumption. Despite this historical precedent, the war on drugs has stubbornly clung to the same failed strategy. Banning drugs does not eliminate demand. Instead, it drives the trade underground, empowering dangerous criminal organizations. These groups thrive in the shadows, operating with impunity and resorting to violence to protect their lucrative business. The war on drugs, much like alcohol prohibition, has created a thriving black market that fuels violence and instability. Collateral damage. The human cost of the drug war. The war on drugs has had a devastating impact on marginalized communities. These neighborhoods, already struggling with poverty and lack of resources, have been further destabilized by aggressive drug policies. The social fabric of these communities has been torn apart, leaving behind a trail of broken homes and shattered lives. Black and brown communities, in particular, have been disproportionately targeted by law enforcement, leading to mass incarceration and the destruction of families. The aggressive policing tactics have not only led to a surge in prison populations, but have also created a climate of fear and mistrust. Children grow up with parents behind bars, and the cycle of poverty and criminalization continues unabated. This discriminatory enforcement of drug laws has exacerbated existing racial disparities in the criminal justice system. Protests and movements have risen in response, demanding justice and equality, yet the scales of justice remain tipped against minority communities, perpetuating a cycle of inequality and disenfranchisement. Beyond the injustice of mass incarceration, the war on drugs has also fueled a public health crisis. Overdose rates have skyrocketed, and emergency rooms are overwhelmed with cases of drug-related health issues. The lack of access to proper healthcare and support services exacerbates the situation, leaving many without the help they desperately need. The criminalization of drug use discourages individuals from seeking help for fear of legal repercussions. This fear drives people to use drugs in unsafe environments, increasing the risk of overdose and the spread of infectious diseases. Rehabilitation centers remain underutilized as the stigma and legal risks associated with drug use keep people from seeking the treatment they need. This creates a barrier to treatment and harm reduction services, pushing people further into the shadows and increasing the risk of overdose and disease transmission. Community-based programs and harm reduction services offer a glimmer of hope, providing support and resources to those in need. However, without systemic change, these efforts are but a band-aid on a much larger wound. The economics of addiction: supply, demand, and despair. The global drug trade is a multi-billion-dollar industry fueled by the simple economic principles of supply and demand. Poverty and lack of opportunity in drug-producing countries drive farmers to cultivate illicit crops like coca or opium poppies. Meanwhile, demand in wealthy nations ensures a steady market for these substances. The war on drugs has done little to address these underlying economic factors. Eradication efforts often displace poverty rather than alleviate it, pushing farmers into further desperation. Meanwhile, demand reduction strategies have largely failed to address the root causes of addiction, such as poverty, trauma, and mental health issues. In 2001, Portugal took a radical step. It decriminalized all drugs, shifting its focus from punishment to public health. Instead of arresting and incarcerating people for drug possession, Portugal chose to treat addiction as a health issue, offering treatment and harm reduction services. The results have been remarkable. Portugal has seen a significant decrease in drug-related deaths, HIV and hepatitis C transmission rates, and overall drug use. This approach, focused on compassion and support, demonstrates that there are viable alternatives to the failed war on drugs. The failure of the war on drugs highlights the urgent need for a paradigm shift. Instead of criminalizing drug use, we need to treat it as a public health issue. This requires investing in evidence-based treatment programs, harm reduction services, and addressing the social and economic factors that contribute to addiction. Stigma and discrimination prevent individuals from seeking help. We need to foster a culture of compassion and understanding around drug addiction, recognizing it as a complex health issue rather than a moral failing. This shift in perspective is crucial for creating a supportive environment where people feel safe seeking help without fear of judgment or punishment. To effectively address drug addiction, we need to look beyond individual behavior and address the systemic issues that contribute to it. Poverty, lack of education, unemployment, trauma, and mental health issues are all factors that can increase vulnerability to substance abuse. Investing in social programs that address these root causes is crucial for breaking the cycle of addiction. This includes providing access to quality education, job training, affordable housing, mental health care, and creating opportunities for social mobility. The war on drugs has been a resounding failure, leaving a trail of human suffering and social ills in its wake. It's time to abandon this failed approach and embrace a more humane and effective strategy. By prioritizing public health, human rights, and evidence-based solutions, we can create a world where drug policies are grounded in compassion, not punishment. The time for change is now. Let's end the war on drugs and embrace a future where health, compassion, and human dignity are at the forefront of our approach to drug use and addiction.